Occupational therapists have a key role in supporting assistive technology interventions. Augmentative and Alternative Communication, or AAC, comes under the umbrella of assistive technology and helps people to communicate, often using alternatives to speech. Aided AAC includes paper-based and powered resources. Both the Health and Care Professions Council and the Royal College of Occupational Therapy have standards outlining that practitioners must take steps to meet service users' communication needs and keep up to date with emerging technologies. Occupational therapists use task analysis to understand function and participation. Person-centred practice and joint goal setting is core to occupational therapy intervention. These considerations make the International Classification of Functioning, Disability and Health a useful framework for exploring the role of OT in AAC interventions. The ICF highlights the interplay between health, environmental and personal factors and emphasises that diagnosis alone does not determine participation. Body functions and structures. Body functions and structures explores physiological functions, anatomy and impairment. Understanding the health condition will help to frame some of the decisions made during assessment by considering the impact on the individual's function. Considerations include activities. Activity focuses on the execution of a task or action by an individual. Considerations include this will inform the individual's access. Access at AAC is a broad term and includes the way a user makes selections on their device with the functional body movement that they have. Indirect access requires a user to scan through an array of options to access their target selection using switches. Direct access allows a user to choose and select without relying on a scanning function and may include direct touch, a cursor setting, or eye gaze technology. Positioning applies to the individual and the AAC system. The individual's seating needs to be comfortable, stable, and conducive to function, without contributing to or exacerbating postural asymmetries or pain. Mounting or placement of a device and access method has implications for how successfully the user engages with the device and for how long, impacting on their overall activity. Communicative competence, originally proposed by Light in 1989 and since revised, considers access and positioning to be part of the operational domain essential to AAC success. Bean and colleagues also highlight the importance of operational competence in the review of communication outcomes. OTs, with their understanding of functional performance, work together with the individual and the wider team to provide insight into access methods that are likely to be successful and reduce abandonment of devices. A range of accessories are available to support access to electronic and paper-based systems, and adjustments to accessibility can be made through device settings, software controls, and changes to formatting of paper-based AAC. Participation. Participation considers the individual's involvement in a life situation and their unique experience of being part of these roles shaped by their body function and activity. Considerations include considerations to the type of AAC used is important to facilitate participation. Implications may include having multiple communication systems, for example electronic and paper-based, so that an individual can continue to communicate while they engage in important activities that are not conducive to powered systems. Personal factors. Personal factors are the influences on functioning specific to the individual. They are not always related to the specific health condition, but will play a significant role in the outcome of any AAC provision or continued use. Personal factors to consider include personal factors influencing the journey of AAC use emphasises the required dynamic nature of the provision requirements. A young person may start their AAC journey with a specific vocabulary, friendships and interests. However, consideration needs to be given as to how these will change over the years into adulthood, with the user central to the decision making. Person-centred goal setting will support the professionals in ensuring they give necessary attention to what the client sees as important, including their values and preferences. Environment. The ICF views the environment as a potential barrier or facilitator to function, encompassing physical, social and attitudinal factors. Discussion with the person using AAC and their support network regarding their daily routines, meaningful activities and positioning options will help to build a picture of their life and the context in which the device needs to be accessed. Most often, people who use AAC transition through a range of environmental contexts throughout their day, and therefore the compatibility of the AAC and each of these settings must be considered. Experiences and perspectives of people using AAC have been considered by Broomfield and colleagues, with themes emerging around portability and practicality in different environments, in addition to the response of others when using AAC to communicate. Communication partners and their skill is a large focus of the social environment. Individuals new to using AAC need the support of others in terms of technical understanding of a device and software, in addition to others adjusting their expectations of communication exchanges around speed and weighting. The professional network supporting the individual in their AAC journey is vast due to the complexities that need to be considered. Occupational therapists are an integral part of a wider team who support individuals using AAC.